Okay, all right, everybody ready? Ready. Okay, I'd like to call the September meeting for the Human Services Committee to order. The first order of business is the approval of minutes from August 21st. Do I have a motion to approve the minutes?
So moved.
Okay, Jamie, second. Susan. All in favor?
Aye.
Aye. Okay, next up is privilege of the floor. Is there anyone here to address the privilege of the floor? Okay, come up front.
Karen Engstrom, town of Chautauqua, village of Mayville. I'd like to ask the question regarding industrial solar. As I've given updates here before, I have a question. Who is now selling, promoting, and gaining money from nuclear energy, from small modular reactors? One of our favorite politicians, the former governor, is now hawking small modular reactors because he knows what the future holds. Part of the Wall Street Journal evidence is that the investors have pulled out of wind and solar. So we're going to be stuck with them if we continue on this path. What I see is we are beginning to look like the frog in the proverbial boiling pot as we look to solve the energy problem. The situation is becoming worse, not better. A comparison, Nebraska, the state of Nebraska, residents there pay 9.8 cents per kilowatt hour for electricity. In Pennsylvania, it's 18 cents a kilowatt hour, and in New York, it's 28 cents a kilowatt hour. Nebraska uses a ratio called energy returned on energy invested. It is an essential concept which weighs the cost benefits of how much energy is put in order to end up with a measurable amount of energy as a result. In our case, solar is very difficult to gauge in this area. It's been described as almost nothing, up to 10 to 12% by NYSO and NYSERDA. What we have seen in the past is an alternative that Dunkirk provided. Dunkirk is exhibiting some financial difficulties right now, and it's partly because 40% of their tax base was taken away from them by the state. 40% of their tax base was based on the NRG power company that is still there, still sitting on 100 acres, still hooked up to the internet, to the grid, and still capable of doing what they planned to do with it. They almost had it completed. They were recycling it, revamping it to become a dual cycle. That means they use the heat from the gas-produced electricity to reinvest it into the system to make more electricity. They were going to have 480 kilowatt, 460 plus megawatts of electricity produced, and they were planning to double that to 800 plus megawatts. That was dispatchable, affordable, reliable, dual cycle, clean gas energy. It was produced 100% of the time. In the case of solar and wind in this area, as I said, 12 to 15% of what the grifters and the developers claim is all it produces. NRG has been shut down. We see the same situation with the Board of Public Utilities in Jamestown, which is a public utility, a wonderful example. It returns all profit to the community and does not drain the taxpayers. I would like to quote one of the commissioners from the Federal Energy Regulatory Commission, FERC, who said, quote, "You must back up solar power with baseload gas, coal, nuclear, so the grid system will not collapse. Solar is not efficient, and ramping up gas and coal over and over to back up solar causes wear and tear on those systems." So you're double dutying your entire energy system. You have to have full backup of gas cycling behind in order to maintain the grid stability. Solar also creates heat islands, 5 to 7% increase in the heat in those regions where there are solar panels in large quantities. They also create electromagnetic frequencies, which have been determined to be harmful to humans and other life. It's imposed at a great cost. It is not dispatchable, not competitive, and there's an article attached. BESS has been proposed. That's the next step in putting our frog from warm water to hot water. Battery energy storage systems are being proposed for our region. The one that's going into Ellicott claims 100 megawatts, but that storage is only for 4 hours. These BESS units can only maintain the grid for 4 hours. But the cost is $100 million. Try that on 19 little towns in our district, in our county. $100 million is what has been indicated would cost for this BESS proposal. I think the fraud is stunning, and when you talk about the safety of the BESS, you can talk to the firefighters in many towns in New York where there have been incredible conflagrations. Safety concerns are very well known: catastrophic fires, explosions, and the release of toxic gases. We have seen in the last day explanation of what happens when lithium battery explode due to heat. Hezbollah experienced it very seriously yesterday.
Karen, if you could wrap it up real quick.
Okay. I have several counties in western New York that have passed solar laws or regulations that protect the residents and the environment from solar blight. We're asking that you consider doing what you did for wind and prohibiting payment in lieu of taxes for solar, requiring the recycling of the valuable solar components, and/or requiring written guarantees that PFAS, the toxic forever chemical, does not exist in solar components, which would be the case in all solar components from China. And China is therefore controlling our grid if it controls all the components. So to answer the question of Nebraska using the reason that they are only paying 9.8 cents a kilowatt hour is because they use abundant dispatchable clean coal and clean gas to make their electricity. And we have the same availability. Thank you.
Thank you. Is there anyone else for the privilege of the floor? Okay, seeing none. Come to our first tabled resolution, which is reallocating a salary grade for case manager in health.
Mr. Chairman, if you want to consider this, you need to have a motion to bring it off the table.
Okay. Do we have a motion to bring this off the table?
So moved.
Ms. Legislator Gustafson, do we have a second? Legislator Pavlock, all in favor?
Aye.
Aye. Okay. It is off the table.
Good evening.
Thank you. Good
I
evening.
am Lacey Wilson, Public Health Director.
Wendy Douglas, Director of Patient Services.
We are here on behalf of the now no longer tabled resolution to increase specifically our EI, our early intervention case managers, from a grade 12 to a grade 14. This proposed resolution is in regards to really the larger strategic planning and staffing planning that Dr. Falk and I have been doing for the Public Health Department. We felt as though this were a priority area to really address in regards to bringing these case managers up to a closer level and salary grade in conjunction with similar work in case management in other departments throughout the county that typically start at like a grade 16 and up. So Wendy is with me here today because, again, it is specifically for the early intervention program. For those of you who are not familiar with that program, it serves children and families ages 0 to 3 and connects them with service. Well, really, we provide the service coordination, connecting them with services in the community that ensures development despite maybe slower growth milestones that have been noticed early in life. A number of the families and children that we work with come from referrals through CPS in our partner agency, as well as school districts, doctors' offices, that type of thing. They're going into homes, following children and families for a lengthy period of time. We felt that this increase is very much so justified, not just from the financial and department side of things, but also because of the wonderful return on investment it provides in the community.
Okay, is there any questions? I've got one or two.
Mm-hmm.
This increase in salary, how much will this increase your budget?
So to the budget, including wages, fringes, it's $28,000 over the year
Over the year for one person?
for 5.
5 people?
Mhm.
Okay. 6 people?
Technically 6, we have a vacant position, yes. Mhm.
Okay.
And that's budgeted?
It is budgeted in the 2025 budget.
Proposed.
Proposed. Yeah, sneak peek here for you.
Had another question and it escaped me. Do you have anything?
It was such a great answer.
Do you have anything from memory?
So is that going to affect now or the first of the year?
We're working on that. We're looking into that with the finance department and the finance team. But really, all things considered, in order to get paperwork and things filed, it would be closer to the first of the year anyway.
I remember now. So an additional 28, proposed 25 budget, so to speak. Are there any plans to cut back or to balance that 28, or is this?
So that balance work was actually already done in the 2025 budget. So we actually feel really confident in the staffing and personnel costs that we have specifically overall,
Okay.
but specifically for this account. Part of the increase here that we're asking for, again, not just because they do such great work and to bring them up into a level that's closer with everybody else, but this is a program that continues to grow. As you can imagine, it is a mandated service from New York State. As the provider of last resort, the health department, we provide this service in the community. And the numbers have grown for a number of different reasons. We saw an initial large burst in the last couple of years that we know is really due to the fact that COVID backlogged a number of assessments. Assessments for these children have to be done in person. So now we're seeing kind of an influx of children and a higher caseload because of that, but then also just children being exposed to, substances in utero, and we're just seeing higher needs now at this point. So really, not only is it necessary work to do in the community, because of course we want to and it's mandated, but we're just seeing so much more of it. So the typical caseload that New York State would really suggest that an EI case manager hold is around 30 to 40.
30 to 50.
30 to 50, and our case managers are holding an average caseload of 60 to 100.
100, yeah.
So, they're doing a lot.
You're proposing this for retention purposes, in the sense that you just want to make sure that the individuals are motivated to stay a little better. And currently, so someone, if you're like this new hire, I'm assuming, are they going to start at like a step 3 or a 4, and then eventually, what's the ratio of the people that you have at the different steps? Do you know that kind of offhand?
So the new person would, and Debbie would speak to this more so than we would, but the step 3 is now the step 1. So
Okay.
they would start there. Otherwise, we do have a number of people who are in a range of steps at this point.
Yeah, our longest, I think, is like 6 or 7 years that have been employed.
Okay.
So we have lost a number of people in the last couple of years.
In loss, why?
Yeah.
Do you know? I mean, I know it's a random, but other departments,
Some.
because of the gap, or other agencies, not county affiliated.
A combination
Mhm.
of above. It would be both.
It is a combination. I would say, though, in general, we really don't have, we are more so to your point, we're wanting to encourage a sustainable staffing plan here. We don't want to see turnover in the program, and so before we get to that point, we really are taking a hard look at what we're seeing across the state and the nation in terms of these types of service coordination roles, more in the realm of social work. You all are very familiar that this is difficult work that people do. And so we're just doing our best to be proactive so that this doesn't become a problematic personnel situation. we feel really confident in having worked with HR and the union on this, that this is a really great option.
Can you go over the state funding, again, like the percentages?
Yes.
Yeah.
So the percentages that I was talking about,
Yeah.
that is related but also unrelated to this program, because our state funding happens in basically kind of two major ways. We get allotments of funding, which the state often calls grants, but they're really not grants as we would discuss them to be. That is how EI is funded, is really through an allotment based on really your prior year's caseload and service of how many children we serve. So there's an algorithm and a calculation that's done, and we're provided a certain allotment of that from year to year. The base amount that I was talking about before, that has to do with some of our other services, but our department receives a base grant of about $750,000, and then from there, other services that we don't have an allotment for, we're reimbursed for those services at 36% or 36 cents on the dollar for providing those services.
So the actual percentage that early intervention gets is higher than 36%?
I don't know if it's broken down into a percentage. It's really, and Sam and maybe not Blake, but Sam might be able to speak to that a little bit better. It's more of a lump sum allotment that we get.
It's been a while. I'm not entirely familiar, but it is like a percentage, and then there's part of it through the state.
Okay, yeah, so some of our personnel, because Wendy's in the mix too, so some of her personnel costs as part of being the supervisor would be that 36% reimbursed. It's a whole funding formulary that is
Really hard to.
very difficult to, and why we rely so heavily on our finance team and our partnership with them.
So, because you've had increased numbers, are you anticipating a higher?
We would hope so, but that's not necessarily the case. They will oftentimes cap you at a certain amount. So we see that in another related realm, like with our preschool transportation. We are required to provide this transportation, but the state will only provide so much money for that. We are still required to participate and provide that despite how much they reimburse or allot for us. And sometimes they can audit and ask for money back and things, you know, it's a whole thing.
Okay, thank you.
What type of degree is required to ascertain this position?
Currently, it's, it could be based on experience, so it could be, an associate or possibly even a high school, depending on experience, but also, we prefer, if able, to obtain somebody with a four-year degree.
Okay.
Those requirements have had to have been transitioned over time in order to find people to come and do this work. I'm sure our partners in other departments would attest to the same. It can be obviously very difficult work. And there is, as Wendy was saying, some of that training is almost invaluable, because you can have a four-year degree in this, but to have the life experience into how to manage the dialogue and the rhetoric is invaluable.
From the state perspective, you could use a nursing license as well. So that could be a 2-year or 4-year. So certain, like if you're a therapist, you could apply to become a EI case manager as well.
Is
I
there
don't-
certification or a training period for them to,
Not a certification, but
There's
training.
Mm-hmm.
that they are required to
Yes.
take? So,
Yes. And that's very typical of state agencies. You'll see the same in social services. There is a lengthy and very robust training program.
so retention is very important
Yes.
in order to just continually keep.
Yeah,
training new
yeah. So
people.
not only important, of course, for county budgetary purposes in terms of you don't want to see that turnover, but also for the health and sustainability of program services for these families in the community.
Do you see, so you said the recommended average caseload should be 30 to 50, and currently we're at 60 to 100?
Yes.
How is that?
The additional, that vacant position
That
will
vacant
be,
position will-
and then again, this is part of
Um,
larger staffing plans that we have for the organization to help offset some of that caseload work, the
Okay.
number of hours and things like that.
And you alluded that numbers are high based on some parameters. Do you expect them to decrease in the future? Hopefully.
That would depend on what our community does.
Yeah. We won't see that initial big bump unless we have another sort of, COVID pandemic type thing that happens and we aren't out doing evaluations. But there has been a very steady, long-term increase that we've seen over time.
I think Kitty said the other day that the 28,000 includes fringe,
Yes.
right? It includes
Mhm.
all the benefits.
Yes. Yeah, so for 5 staff members, it's relative. That's not my decision to
A
make,
little
but.
over 5 per, so
Mhm.
it's not, well, 6, I guess, if it's 6.
True. Mhm.
A little over, a little less than 5. Any other questions? All in favor?
Aye.
Thank you.
Thank you.
Brings us to number 2, a proposed resolution, confirm reappointments, Chautauqua Opportunities Board of Directors.
James Feldman from the County Executive's Office. So we have the proposed resolution to reappoint 4 members to the Chautauqua Opportunities Board of Directors. Marie Karuba, Kevin Whitaker, legislator Bob Binkowski, and Natalie Liskoziak. There is one correction that would need to be made on legislator Binkowski's appointment. The term is 6/30/2025.
Oh,
Does that have to be just a correction?
typo.
So we don't have
I
to
think we can
amend
treat
it?
that as a typo.
Okay.
Yeah, it's typo.
That was definitely a typo.
These are all reappointments, correct?
Yes.
Okay.
Yep, for a 1-year term.
Any questions, concerns? All in favor?
Aye.
Thank you, James. Proposed resolution number 3, to amend the 2024 budget to implement the morgue project using funding from the American Rescue Plan Act, better known as ARPA.
Good evening, Dr. Mike Falk, Chief Medical Officer for Chautauqua County.
Anthony Shekels, Corner Supervisor, Chautauqua County.
So as some of you or most of you remember, we had a discussion maybe about a year ago, maybe less, time flies, about this topic of a morgue. At that time, we had discussed and proposed a portable tow-behind morgue type of unit. There were many reasons for that. Number one being to improve our emergency preparedness throughout the county and really throughout the region. COVID taught us one thing, taught us many things. One of those being we really had to think hard during those years about what we were going to do in the event that there were a large number of deaths that exceeded our capacity within the county. Thankfully, we didn't get to that point where we had to seek out, morgue type trailers. A lot of areas in our country did, however, and we really got to thinking that in this day and age, whether it be, heaven forbid, mass shootings, another pandemic, we have to be prepared. We have very limited morgue space availability within the county. For a variety of different reasons, it is challenging to find space for our decedents to provide them the dignity that they deserve at that point in time in their life. And we at times have a need to have our own morgue services, number one. Last year, when we had this discussion, there were some questions about whether or not it might be feasible to establish a brick and mortar type of county morgue. We did look at a number of different locations, both county-owned, some hospital-owned outbuildings, some private locations. However, we found that in particular the county-owned facilities, for there to be a morgue facility there, it would require a significant amount of money to upgrade the facility to accommodate a morgue. The cooler itself would be somewhere along the lines of, if we did a brick and mortar, the cooler itself would probably be somewhere along the lines of $50,000 to $75,000, which, with our budget of $100,000 with this ARPA request, it would work. However, it would probably cost at least a couple $100,000 more to do some updates to a building within the county. We have to be very sensitive in regards to, and thoughtful in regards to, where we place a morgue. Traditionally, these facilities are located in a hospital, which is kind of to be expected within the community. But we cannot just place a morgue in a random building in a residential neighborhood or close to a county building where there's a number of county workers. So we came full circle. We have done our due diligence in regards to looking at a brick and mortar. We do not think from our perspective that that's the best idea at this point in time due to the significant investment that would take. And we do genuinely see a benefit in regards to emergency preparedness in having a portable refrigerated unit that would be in service when we need it. As we've been discussing, we are looking for opportunities to really enhance our program, our corner program, and specifically looking for ways to keep our decedents here in the county, not send them out to the medical examiner's office. This space allows us room to perform our investigations that we need to perform. It allows us the space to be able to provide a space for a decedent if in the event we cannot find next of kin or there's some type of delay in getting the decedent to a funeral home. And it also gives us the ability to not be required to send up a decedent to the medical examiner's office at 11 o'clock at night when we can do it at 7 o'clock the next morning with our own coroner vehicle, which should be ready to go here in a couple of months. So I think there are some cost-saving advantages over time. One of the concerns when we discussed this last was just the longevity of the unit given the weather. We have looked at, and I can let Tony comment a little bit further about this, the longevity of these units is 20 plus years. Aluminum frames, and keeping in mind that this is not a trailer that's going to be on the road every day. It's going to be on the road on occasion, and in the bad weather on occasion. We are proposing this budget amendment for the $100,000 as recommended by the ARPA committee to go towards a portable morgue trailer with generator capabilities. We have some ideas where we would store the unit for the time being if the unit has to be in service with a decedent. We have worked out, sort of a verbal agreement with emergency services to use some of their facilities up across the street and, pull a vehicle out and put our trailer in the event that it's in service. We have some other ideas that we're working through to house this trailer, but obviously it would not require a $250,000 renovation on a building. The trailer is secure, it is dignified, it is appropriate for this type of use. And we have the opportunity to be good neighbors. You know, our adjacent counties, the one to the north of us in particular, you know, has had a mass casualty, mass fatality incident within the last couple of years. And this allows us to essentially, you know, potentially offer some help to an adjacent county in the event that that were to happen. Anyways, I think Tony has a couple of pictures of some examples.
Yeah. We can just go to the. So this is a video example of. Let's see if this works. Of what we're talking about. That's the picture. Oh,
Yeah, go for the video.
and come back. Yeah, you can play it.
Disaster Portable Morgue Units, DPMUs, are mobile, self-contained refrigerated trailers used to expand morgue and hospital mortuary capabilities. Each unit is outfitted with low entry floors and ramp systems, seamless interior surfaces, and customized expandable racking systems that accommodate industry standard equipment, shore and generator power systems. Acella's morgue trailers are available in a variety of sizes, from 14-foot up to 40-foot interior length, and all are manufactured to maintain 35-degree Fahrenheit interior temperatures in 120-degree Fahrenheit outside ambient temperatures. Acella incorporates a variety of different construction techniques and optional accessories to match any client's requirements and budget. From an escalating multi-casualty incident to a full-blown multi-fatality incident, from an on-site aircraft crash incident to a pandemic-caused mortuary surge scenario, Acella has expertly engineered solutions to match your needs.
And I think I just have a couple pictures of different. Can I get back to the PowerPoint?
What size are you considering?
So I was thinking 17-foot trailer will hold with the option of up 9 to 12 bodies. That size trailer will hold up to 16, but I'd like to leave a rack system out. So like Dr. Falk had talked about, we had a spot where if I want to take a body back to the morgue and put it on a table and draw blood from it, so I'm doing it in private, or you know, examine it more closely before deciding whether or not it goes for an autopsy. That would give us the space. So that's a 17-foot trailer, one that we got a quote for, and then this is another example of a 17-foot trailer. There's only about 3 different companies really making them right now, but during the pandemic there were a lot more. I think that would fit our needs. It's not over the top, but they are expensive.
How much are
That's
they?
that 17-foot would
Yeah.
fall under the 100,000 budget that you're asking?
Well, we'd have to put it out for a quote. The quotes I've gotten, one was 111,000 with the generator, one was at 98,000 with the generator, and then I did quote a small one that would only hold 4 to 6 bodies, and that was at $36,000 with the generator.
Depending on how we move forward with this, will dictate whether or not we'd have to put this out to bid. It's such a small focus and a very specific need. So there are a couple different companies, and we may have to put that out to bid. So we're hoping that that could be fairly competitive. But we do have a budget to stick to, and that's what we'll do.
Where would you store it at or keep it at?
Well, I think we have a couple different options. Emergency services, number one. You know, we have discussed recently about our lack of, you know, storage facilities for equipment. You know, our mobile health vehicle being one of them. You know, we've been lucky enough to find some places to put it in the wintertime. But we do struggle with some capacity for storage, I think, not only our department, but perhaps others as well. But we do have, you know, emergency services as one option. I mean, you know, there's no downside to having it outside when it's not in use necessarily, as long as it's not in the, you know, the salty roads and things like that all the time. So when it is in use, it would be inside. There may be some options with Murphy Training Center, Fire Training Center up in Dunkirk as well. There are some potential interested fire departments who may be losing some apparatus that we may be able to engage in a lease of some sort to help store this. That's just one idea. Not sure if that'll happen or not. But, you know, they mentioned, you know, airplanes and airports, and, you know, we do have, you know, two busy airports in Chautauqua County, and we all know we have had multiple plane crashes over the last several years. And, you know, nobody likes to talk about death, but, you know, we all know the saying, right? There are two absolutes in life, and death is one of them. And sometimes they come in multiples, unfortunately, whether it be an accident on I-90, buses and semi-trucks. We have the potential for catastrophe, and we know this. Just read the news every day. We know this, and we have to be prepared for it. We have the opportunity with this funding, I think, to do something great. And, you know, and ARPA came out of, you know, the problems with COVID. And I go back to, you know, what happens in the event we ever get hit with another pandemic, heaven forbid. We have to be prepared. And that was the whole point of ARPA in the first place. And so I think this fits within the definitions and the confines of what ARPA was all about. This will benefit families of decedents. It'll benefit our, you know, bottom line, hopefully moving forward with our coroner budget. And, you know, if it does last us 20, 25 years, it still has value.
Questions? You know, I think that I have faith that you'll find a place to keep it when it's just sitting around and not in use. But, you know, I think finding that place for when it is in use as a morgue is important. Also, does it have the ability to be able to hook into a power supply so that way?
It has shore power and a
Yeah,
generator.
okay, so if it's not in use, so that's a little challenging in the sense you have to have a specific
50 amp.
place to plug that in. So once you find that out, gotta have the plug, but that's kind of gonna be your place to put it when it's in use, which isn't a huge issue. It's just you gotta find that space.
Yep.
So we've certainly seen you here a lot, Dr. Falk, with increases to your department here, and the truck and a trailer, but all for the good. Unfortunately, you know, over the years, this department has, I don't want to say neglected, but maybe so, because look at how much we've really built it. And I think that this can be well utilized, and you know, and we do have the ARPA funds that are funds set aside for these items that are of need, but sometimes you don't want to pay for or budget for, and also old infrastructure, so it certainly fits the use of these funds. So I think the shelf life of it is, you know, hopefully it'll last, and I think the aluminum frame and stuff is a good idea. So I think overall, if you see it beneficial to the county, then I can support it. So,
You know, anytime we make a purchase, we want to be able to be excited about using it. This is not the case in this particular matter. My hope would be that we're sitting here in 5 or 10 years and we haven't used it. You know, we will use it on a case-by-case basis. I don't want to have to use it for a mass fatality incident. But really, you know, we're, you know, even, and we've had fatalities of 2 or 3 at a time. And this may come into, this may play a role in some of those, whether it be a car accident or, he even mentioned all of the possibilities, but we'd all know the world that we live in, so. Yeah.
I have a few questions. Are there any other morgues in Chautauqua County?
So, each of the hospitals has the ability to store a decedent. So UPMC Chautauqua has the ability to house one of their decedents.
Okay.
They have basically a cooler room, a cooled room, for temporary purposes. What we talked about, the last time we discussed this was, we unfortunately have some situations, as you could imagine, where decedents are in advanced stages of decomposition. And in those particular cases, there may or may not be a reason to send them to the medical examiner's office. We have had times where we've had to figure out a way to house those decedents locally. And we have had cases where we've utilized a local hospital, and it has created tremendous problems for them with the odor emanating through different departments of the hospital, which is a problem. We may have a similar issue here, but if we're utilizing, say emergency services, they're very limited. We're not talking about a big busy hospital where there may be a few employees or something that might be subject to that kind of thing. But that doesn't happen very often, but when it does, it's a problem. And so that was one of the reasons why we thought of going this route. Westfield Hospital has the ability for one. They pretty much use that for their own folks. And Brooks, I think, has the ability for a couple. But the hospitals are very hesitant because maybe not in the most recent past, but in the past, they've been kind of, stuck with a decedent for a prolonged period of time, and it's not necessarily convenient for them. So they're very hesitant to help us out.
So when you say the medical examiner, who is that?
The medical examiner is Erie County Medical Examiner's Office in Erie County,
And that's
New
where
York.
a larger
Yeah.
morgue is or something?
That's when we send somebody to the Erie County Medical Examiner's Office, it's typically because it's a suspicious death. All homicides, suicides, drug overdoses, traumatic incidents go to the medical examiner's office for now. There may be opportunities in a cohort of decedents where we may be able to take care of some of those ourselves, such as a drug overdose. This having a local morgue facility like this gives us the space to work in, and we can start then drawing blood, sending those labs off ourselves, and not having to spend the $3,000+ to send a decedent to the medical examiner's office when we can handle it ourselves. And so again, just like with the presentation with the coroner vehicle, this will help us, and it'll almost over time, and I bet you over that 20-year period, it'll pay for itself. Right? I mean, we recognize that, the ARPA funding is not just free money for the county. We're all paying for it somehow, I suppose. But I do think this is a wise investment, and we will be able to realize some help from a budget standpoint over time. So
I guess what I think is that, that all makes a lot of sense, but having first of all, do you have to keep it at 35 degrees all the time?
no,
Just
it
when it's being
cools
used.
down really quickly.
Okay, and then, so that's less, cause I imagine it's pretty expensive to keep that space cool, but, for 9 to 12 bodies, I wonder if in the last 100 years we've ever had, I know there's incidents, obviously, And I would imagine that the county if they had an incident like that, would have, counties work together like you wanted to. So if you, I guess my question is, what about the smaller one? I know you have $100,000, and I also really thank you for your efforts with the, standalone and how, there was a lot of work put into this, and I really appreciate it.
The downside of the smaller one, and it really just has to do with room, is a 10-foot trailer, and there'd be 2 racks in it to hold 4 to 6 bodies. There's no room to actually go in there with a cot and do anything with a body. You know what I mean? I can't. You have a space about this wide to go in between 2 sets of racks.
Is it the kind of thing where you could have a 3-person?
But it's possible if that's what the
And then
community
have the
wanted.
extra.
Yeah.
I guess that would be,
Now, here's my thought, and I understand what you're saying,
Yeah,
and I worked
yeah.
in law enforcement for 26 years. Probably thought I would never go to a mass casualty event, but I did go to a mass casualty event, and it happened at a parade. We have a huge parade in this town every year, and all it took was one person to drive through that parade, and you need that trailer.
yeah, no, I get that emergency. But I guess I envision that if that happens, and I don't mean to at all minimize anything, that what happens is other counties help out, other places help out.
Other places will help out, but that takes time.
Okay.
Well, there are, and to your point, Ms. Parker, there are federal assets, where if there was a massive fatal event, if there is a federal disaster declared, we would benefit from federal assets. But as Tony mentioned, that takes time. That would be a response time of days likely. And that would require just a massive earthquake or a massive something or other. The other real part of this too, and we've been in this situation twice over the last year and a half or so. The blizzard in Buffalo, we couldn't get any decedents out to Buffalo at all. We got lucky because nobody was dying during that time in our county, or very few people were. And the hospitals were able to utilize, and the funeral homes were able to utilize their cold spaces during that period of time. But it could have been a bad situation with us not being able to get decedents up to Buffalo. And the other time, I'm blanking on it. The medical examiner's office was closed down for the weekend because they were redoing their floors or something like that.
Would there be ability to utilize some of the space for like a hospital or that, or are they looking for space at all ever?
I don't know that they've never come to me with needing space. But
Because
it could,
you don't have
I mean, it
the
could happen. I
space,
think
right?
the idea of the ARPA money to begin with in New York City was to have facilities like this that they could take, and they use semi-trailers in New York City.
Sure.
So there could be a time, but it's so rare. It's just like that mass casualty event. It's so rare. When does it happen?
Yeah, well, those agencies haven't come to you because you don't have anything, but if you have one, do you think you try, utilize the space if it was available?
If they would use our facility, you mean? I mean, we would offer it to them if they needed it. I mean, if they were at capacity, we'd certainly help them out.
Yeah.
And we could enter into a contract for, X amount of dollars to,
There's some potential there in sense too that
Yeah.
it just is a possibility. They haven't reached out because you don't have the space, right? But if you do have the space, maybe there's a possibility.
Okay, is there anything else? All in favor?
Aye.
Okay.
I'm voting no, sorry. I'm
Opposed?
thinking
No?
about it. Thank
Okay.
you.
We have one no.
And we're good.
Thank you.
Thank you. Okay, proposal resolution number 4, amend Chautauqua County Department of Mental Hygiene and Social Services 2024 budget for increased safety net costs. That one took a long time. you could introduce yourself?
Diana Songer, Deputy Director of Finance for Human Services.
Carmelo Hernandez, Commissioner of Mental Hygiene and Social Services.
Good evening, John Anderson, Deputy Commissioner, Social Services.
The resolution before you is to amend the 24 budget for increased safety net costs, which result in an increased use of the fund balance of $1,500,000, an increase in appropriation accounts of $2,500,000, and an increase in revenue accounts totaling $1 million. These increases are due to economic trends. As you may recall, a discussion a couple months ago regarding the trends and potentially needing to amend the budget. These are mandated services. They are very difficult to predict. And we may need to do an additional amendment at the year end if trends change.
The cost increase is a result of increase with safety net. I'm pretty sure you all are familiar with safety net costs. It's in various forms. A lot of it is direct to the pandemic relief that is no longer there, and is due to the increased emergency temporary housing demands that we have as a whole across the nation, especially here in New York State. And a lot of this is due to data that we got from NYPWA, which is the New York Public Welfare Association. So I'll give you a quick example. In 2018, we were at 1,027,839. From 2019 to 2021, it dropped to 500,000, between 500 to 600,000. 2022, we see it spike back up, 1,366,532. 2023, 2,208,310. And just for some history purposes, in 2010, we were at 6.5 million, 2011, 8.1, 2014, 8.6, and in 2021, it dropped. A lot of this is due to the nature of course, the pandemic. So costs came down, and due to all the funds that were available and the housing reprimand. So housing costs, market value costs plays a huge role. Temporary housing, emergency housing plays a huge role, and our housing stock plays a huge role as well when it comes to this, when it comes to safety net. And this is just across the state, unfortunately.
Does that include long-term care, or that's a separate?
No, it does not.
Not Medicaid or anything?
No,
like
that is not this, no.
Okay, thank you.
Will this be the the second time we've increased it this year, or is it the first time?
First time.
First time. But we did increase it for the 24 budget last year at this time.
There was an increase 23 to 24,
Yeah,
yes.
okay, that's what I'm thinking of.
I believe that's accurate, Blake, yes. Yeah.
How do you foresee 25?
Well, as far as temporary housing costs go and safety net overall, I don't expect that we're gonna see any decrease. Where all of this lands, I don't know, because we're all in the same situation across the state with all of the things that have impacted people since the removal, as Carmelo mentioned, of the pandemic relief. During that time, we had significant decrease in costs for temporary housing and for cases, and that has gone right back up. I think probably last year, we were at budget season, we talked about thinking we're gonna get back to earlier levels prior to the pandemic. We're still not back at where we were, I believe, in
2010, 11?
yeah, 2014, we were $8.6 million, so we're definitely getting to that point. So we'll have to monitor that pretty close. I think that Diana mentioned we may have to come back again this year for another request. It's all dependent on how things are out in the community. I think that was mentioned earlier too with the health department, that a lot of this depends on what's happening locally.
So it sounds like before the pandemic, it was just as high.
It was about the same, and we've gone through cycles. A few years ago, there was some conversation about safety net and also temporary assistance costs, which is, I think, under family assistance in the budget. And we talked about the fact that after that 2008, 9, 10 stock market crash,
Yeah.
we saw the year after year climbing of safety net costs and temporary assistance costs. So we're kind of getting right back to that spot right now.
Okay.
But yes, it did go down during the pandemic with the relief.
Because there was money that was coming in that wasn't coming in.
That's correct. And also there was an eviction moratorium, so at the time, I know the press was saying that people were not paying their rents. And since that time, what's happened is landlords have gone ahead and increased rent significantly. which
Yeah.
is making it difficult for people to find good places to live.
Okay. Uh-oh. Anything else? Unfortunately, we knew this was coming. All in favor?
Aye.
Any opposed? Motion carries. Proposed resolution number 5 to amend Chautauqua County Department of Mental Hygiene and Social Services 2024 budget for increased daycare costs.
This resolution to amend the 24 budget is for the increased daycare costs results in an increase in the appropriation account of $3 million and an increase in revenue accounts. It is budget neutral. The current allocation was received after the 24 budget, and it was higher than was expected.
And by the way, it's called daycare, but what they're talking, it's actually for child care grants that families receive based on income eligibility. And some of the increases that you're seeing in the cases is a result of changes that were made in 2023 by New York State OCFS that opened up the eligibility levels quite significantly. Right around $100,000, a family of 4 is eligible for a full grant, except for 1% after the poverty level. So after that income level, people are eligible. 99%, I'm sorry, they pay 1% of their income toward the cost of childcare. So that's made a huge difference. I think there between year to year increases about 167 cases, and that's sizable. There was concern. I know Sam and I last year, he ran a report looking at where we might land as far as if they were to continue funding at the levels they were funding at before the state. We would have probably run into some issues in 2025, 26, where we'd have to start cutting people from the program. But the state went ahead and made a large investment in childcare, and so our allocations have increased sizably. So much of this is funded. For temporary assistance, for public assistance cases, it's 75%. For the remainder, it's 100.
No, I see the benefit to this program and why the state is wanting to invest in it, and as well as locally while we're investing in it and putting skin in it, is families, sometimes if it costs them a good amount to put their children in daycare, they aren't making it, you know, it costs just as much as what they're making. So it's a real burden, and sometimes you wouldn't see someone maybe seeking a job or certain jobs just because of the cost benefit. But so I really support this program. It opens that up. Would you say that most of, you know, some of these cases aren't necessarily daycare facilities that are doing it, but other family members, or
Yes.
you know?
Yeah, there is a number. I don't have that number as far as the proportion, but yes, a large number.
Get a guess. I mean, would you?
I would hate to do that right off the top of my head,
okay.
but I will definitely get that number to you if you like it.
Sure, and if it's not a hard number to get,
No, it's
I'm
not.
sure we'll be listening to you again tomorrow.
Yes.
So that would be a good number to have if we could.
I'll try my best.
Thank you.
Any other questions? All in favor?
Aye.
Opposed? Motion carries. Resolution carries. Where are we, number 6? Proposed resolution number 6 to amend 2024 budget to implement the peer support for UPMC Chautauqua project using funding from the American Rescue Plan Act, ARPA.
Hello, I'm Trish McLennan, Deputy Director with Department of Mental Hygiene.
Carmelo Hernandez, Director of Mental Hygiene.
And here with a request for proposal to use some of the ARPA funding. This is funding that was originally designated to a organization and a project called Strong Starts in Chautauqua County. After a lot of review, it was asked that we bring this back to the table, reconsider it, and look at it a little differently to ensure the services are still being provided, but to ensure that the services are being provided in a more comprehensive way. So myself, Dr. Falk, Kathy Burgess with the Health Department, Wendy Douglas with the Health Department, and Rachel Ludwig with Mental Hygiene met together, and we started reviewing what the needs are and how we could use this set of money. So this is approximately $164,000. And really the purpose of what we're looking at is to improve and to provide better opportunities for moms, pregnant women who have used substances during their pregnancy. That's the population we're talking about. And that is a fairly high population. You can read a lot of different things about it. You can state whether our county has an inordinate amount of that percentage. Bottom line is, any percentage is a high percentage. We do have one hospital in our county who has a maternity unit, an active maternity unit, that is UPMC. So we have, from this time, looked with UPMC to say, okay, how could we partner different with you? What do you need? How could we look at things differently? Because they do have women who come there. I mean, think about this. You're pregnant, you're admitted to the unit, you're getting ready to deliver. You haven't perhaps shared with your doctor some of the substances you're using because you're scared he's going to cut you off. Now you're entering withdrawal. There are times when these mothers, these pregnant women, will leave a maternity unit, go out to a parking lot, use, and come back in to deliver. That's scary. The risk to the baby is scary. The risk to the mom is scary. Okay, and the liability to a hospital is scary. So what we're looking at is how do we better connect with moms? It sounds real simple. You just ask a mom, are you using? You get a doctor to do something. Well, these moms aren't going to necessarily tell that. They don't trust everyone. They don't trust Do Good or Trish because they wonder what I'm going to do. Am I going to cut them off of something? Am I going to call their doctor if they're getting something prescribed?
Or CPS.
Or CPS, or yes, definitely CPS, report them in. So they're scared. So what we're doing, there are specialty training for peers. So in other words, individuals with shared experience, individuals who've gone through this. So in this case, for this population, it'd be other women who, during their pregnancy, did use substances, are now on the other side of that, and have had specialty training on how to work with other women who are using substances so they can connect, so they trust them. So what we're proposing here, what we've talked with our hospital about, we've had several long meetings with the hospital. We've looked to see what the needs are, looked to see the percentage and the gaps, and UPMC Chautauqua was very concerned. And the good news is UPMC as a whole, so UPMC is a 43 hospital system. As a whole, they are seeing across the system this is an issue. It's not just a Chautauqua County thing. It's an issue across the system, and they're prioritizing it. If you're familiar with any of the Pittsburgh hospitals, McGee Women's Center is very, very large, and they're saying we've got to do something. But they can't do it all for every hospital. Each county is responsible, each hospital is responsible. So what we'd like to do is to provide the hospital some startup money with a very clear guidance on what to do. We've talked with their administration, we've talked with their unit directors for maternity, we've met with their peers who they currently have. UPMC does hire their own peers now. They do not contract out. They are very committed to training folks with this specialty training, to work up on the unit, to be there for moms who are identified, either self-identified or identified through a urine drug screen as having substances in their system. And what they would do is they would partner with them, help them get through this, advise them, help them accept the recommendations of the physician, and then help them once they deliver. They would be following up with them an outpatient until they're bridged over to the appropriate services. So not just a one and done, not just get you through hours of delivery and then leave you alone, but actually get you out back in the community and connected. In addition to this, the hard thing, think about if you're a nurse on a maternity unit. Most nurses do not become nurses on maternity units because they love moms. They become nurses because they love babies. So now imagine if you're an RN and you're on a maternity unit and you find out that you've got moms on that unit using substances. It's hard for a registered nurse. I've worked with them in the hospital, and it's hard for them. It's hard not to hold judgment. So another part of this funding is to go toward training and education for the staff on the maternity unit. That goes a long ways. That way they're more accepting, that way they're less judgmental, that way they're more helpful in their responses and their guidance, and also helpful in resources. In addition to this, UPMC very much is saying, you know what, we also want our physicians, our obstetricians to also have training. And they've gotten the support for that. Their obstetricians want the training. So in addition to this funding will help provide that. Now, 164,000, somebody's going to say isn't going to carry for very many years. It doesn't have to. Our training is going to be a train-the-trainer system, so that once we train the peers, once we train the physicians, we're going to work with their staff development department to help with an onboarding plan so that it continues across the way. And this way, they're committed to doing that. We met with their chief nursing officer. Again, we've met with their unit director, peer on the unit, their chief quality officer. So we've been involved, and their COO. They all want this to happen. They're all committed. They're all 100% supportive of this. In addition to so we're talking about a certified peer specialist to start with and the training for that, and then a little bit of money to go towards some startup costs for that. As far as sustainability on a unit, they are committed already to having peers in their inpatient unit, so that part of it, they're already budgeting. So that's okay. So it's a training piece and some startup. On the maternity unit, the training, once we get the training going, that will continue on. We also are looking at connecting with one of their obstetricians' offices outpatient, because they are part of GLPP, so they have some physicians over there, and starting to have somebody stationed in, again, catch it before they land on the unit when possible. So have a peer with office hours or with appointments, whatever works best for them, actually in the office to work with these folks, to talk with them, to connect with them, and to help engage them. And then finally, the other piece of this financial resource would go toward, within the first 9 months, a comprehensive resource guide that could be developed in collaboration with our county departments. And a resource guide, you know, people will say there's 1,000 different resource guides. We have them in mental hygiene, everybody has them, but this would be dedicated toward this population, toward women who have used substances during pregnancy. So resources for the pregnancy portion, resources for that early delivery, resources for those children who were impacted by substances for those first few years especially. And that's what we're looking at. So there actually are some connections. So that's what, I mean, the exciting part for us is that we're not saying hang on to this for the county. We're not looking to keep anything. We're looking for one contract. Christy will be happy with me to hear that. One contract with UPMC Chautauqua, a very close relationship with them. We have several of our staff who, the other piece of it that's real neat, we already have Wendy who does rounds up there on the unit, and we have Kathy Burgess who does unit rounds also. So they're already connected. Our county health department's connected up there. They trust us. Our mental health department's connected. For those of you who don't know, that's that system I came from. I was up on that maternity unit a lot, trying to connect with these moms. It's a really important area. And we're talking about how do we do this, and we're talking about how do we use our funding to address this. Services are available. They exist in our county. We've got to connect it differently. We've got to connect the dots and make it available when the person's ready, not just hand a card. If I hand you, any of you, a card tonight, likelihood of you following up with anything is about 20%. But if I connect you when you're in the middle of it and actually walk you to that, we're up to about 90%. That's the difference. So this can make a difference. We're pretty excited about it. It's a neat collaboration between the health department and mental hygiene too. We're working very closely on this, very supportive. Dr. Falk is very supportive of connecting any way he needs to with physicians too over there. And we have UPMC's top leadership down who are saying, we'd really like that relationship with the county to do things a little differently with the county. So I don't want to keep going because there may be some questions, so I'm not going to keep pontificating, but very open to questions or comments or concerns. Yes?
What program, are you using a particular program that, could you explain it a little bit?
Yes.
Training the trainers?
Yeah, there has been the program that Davina has done through Buffalo. We're looking at that one. There's also one other system that may be better suited for hospitals. So the one that you probably have heard about that has been used through Mental Health Association for their peers was through the trainer in Buffalo. We are reaching out to her to see if that's a possibility, but at the same time, there's another curriculum that may be, like I said, a lot more appropriate. I'm trying to remember what I can have it for tomorrow morning though, that information. We do have it, we do research that it is an evidence-based one, it is well used throughout this country.
Yeah. Maybe you could send it?
Absolutely.
I won't be at audit.
Okay, but yes, glad to share that. But
Okay.
that's an important piece, but we would not do anything that's not evidence-based. And again, the key is evidence-based within the hospital, Some of the other programs we've done through the county has been more outpatient-based. This really is looking at really catching, because there still are a lot of women arriving in the hospital that just are still using substances. And just calling CPS is not a great answer, alone. Needs to happen, but not that alone. Yes?
Is there a connection to, like, I mean, for the kids, there's, I remember there was a part, is there a piece where the follow-up with connecting the kids to services?
For the infants or kids? Which are you talking about?
For
Newborns
0 to
or as you
3.
keep going? Yeah, there's that already, and the good news is with
Kind of
the
what
service.
Wendy and,
Yep, Wendy does their early intervention, and yes, and the diagnoses, neonatals, help me. NAS? I need Wendy right now. Is it NAS? Neonatal abstinence syndrome? Help me out, John. That is now a billable service, and that's been within the last year. So the neat thing is these offices, obstetrician, pediatricians can actually bill for that and actually treat differently. So yes, that connection, and that's also our plan for part of that resource book, to make sure we still support the mom and support that infant and that newborn. Those first 0 to 7 years are the most critical for this type of situation. Okay, great question. Anything else? Yes.
So, you're partnering with UPMC. Do you feel that it's leaving a hole at or other facilities that also that are experiencing this? I know, Brooks
Brooks?
Hospital is certainly a
Mhm.
place that this is an issue also. So, what are we going to do to help fill that need there also?
And we did have lots of discussion about that. Currently, Brooks does not have a maternity unit, so it's very different. So they do deliveries there, as those of you in North County know, but they don't have a maternity unit. They either deliver sometimes there, but then a lot of folks either will choose to go either to Buffalo area or to Jamestown area. Definitely what our hope is if we could get this going and say, here's a model, it's working. It's working at a very large, well-established maternity unit, okay, who's had a lot of births a year. And then say, so how do we then target that down? Because you wouldn't need as much there. If you don't have a whole unit, you're not training one unit of staff. And when you think about it, it's a different kind of training. Here, it's a very dedicated training. Every single person who steps in that unit at UPMC Chautauqua is going to have training, because they're all going to interface with moms. At Brooks, they may be on, I don't know the floor numbers, 2nd floor, 4th floor, 3rd floor. I won't go any higher than that. I don't know how many floors they have, but I probably ought to stop at 4th. But that's going to be a little different at Brooks. So the training and the opportunities will be different. So the plan is, and we did have some good conversation, we also talked, the CNO at UPMC Chautauqua is very well connected with the CNO at Brooks, Julie Morton and Amelia Harley. And they both are very open to, once UPMC Chautauqua kind of gets this in hand, to say, okay, how can we then replicate something similar? And how can we then share the successes, the opportunities, the changes that we need to make, and kind of downsize it, to that type of thing. I'm not sure, because Westfield only has like 9 beds. I don't think they're doing it deliveries unless there is something really wacky. But to train, that would be some strange emergency that this is a very different situation for. That would be more of a referral. But yes, great question for Brooks. And if they do ever, when they do build a new hospital, if they do end up reassessing and deciding to open a maternity unit, that would be the time for that. Excellent question, though.
are you, since Brooks doesn't have a maternity unit, are you able to catch anyone who's born in Pennsylvania or born in Erie County or something? Is there any way to catch people that are not?
There are, probably not through this funding, and I think that's what, and I'm glad you're asking this, and I'm going to, if you're okay with it, I'm going to answer it a little differently. Because our conversations went up and down, which is why we went to that poor ARPA committee, I think 3 different times, and it's taken us 6 months to finally say we're ready. And it happened because first we got too big. First we thought our conversation went to, we've got to solve all the world's problems with moms and babies. And we don't need to. There's already a lot of amazing things going on in this county for moms, the newborns. The early intervention, I can't say enough about the health department. The more I've learned about what Wendy and Kathy does, the more awed I am by the 2 of them and their departments. Okay, I'm awed by a lot of what our own outpatients do. I have staff in my clinics that are trained to work with moms. We have a new family peer that's going to be out, and actually she's doing training and teaching, if you've seen it advertised in the paper, for second time around parents, older parents. But all these things, and often those little ones that they're getting is because of a situation like this. So a 6-year-old whose mom's not able to take care of them is now being parented by a grandparent. So are we helping that grandparent? You bet we are. We just started those training classes last week in Dunkirk and Jamestown, both counties. So we're doing a lot of different things. We said, you know what, for $164,000, let's make sure we do it right, and let's focus in. And let's not pretend that we as the county, and I'm going to say it as a county employee, that we as a county should not be saying we are responsible for everything and should not be stepping on everyone else's toes who have a lot of expertise. This county, I keep getting told by other counties, and I believe it, we have a ton here. We have more than Erie County, Pennsylvania does, and they're much bigger than us. We are sometimes the envy of Erie County, New York, because of what we have. Usually what we're missing, though, is how do we connect those dots? That's usually what we're missing. So we're trying to get more intentional about how we do things, who we bring in, and what we do. So we really focus down. So I know, Susan, that was a kind of a backdoor answer to question, but I hope that does answer why. Okay, well, thank you.
Anything else? Okay, all in favor? All in
Aye.
favor?
Aye.
Anyone opposed? Motion carries.
Thank you very much.
Okay, that brings us to proposed resolution number 7. There was a typo here. It should read amend Chautauqua County Department of Mental Hygiene and Social Services 2024 adopted budget for actual Youth Bureau allocations received, not Health and Human Services.
Diana Songer, Deputy Director of Finance.
John Anderson, Deputy Commissioner, Social Services.
Carmelo Hernandez, Commissioner of Mental Hygiene and Social Services.
This resolution is to amend the 24 adopted budget for actual Youth Bureau allocations that were received, resulting in a budget neutral resolution, increasing the revenue account by $244,454, and the same in the appropriation account. The current allocation was received after the 24 budget was done, and it came in higher than expected.
Any questions?
No.
Concerns? Okay, all in favor?
Aye.
Anyone opposed? Motion carries. Thank you. Table 8, or proposed resolution, I understand is going to be tabled.
Yes.
So we need a motion to table that.
So moved. Second it.
Susan, all in favor of tabling the proposed resolution to amend Chautauqua County Department of Mental Hygiene and Social Services 2024 budget for increased services for recipients' costs, please say aye.
Aye.
Anyone opposed? Okay, motion is, or resolution is tabled.
Thank you.
Thank you.
Discussion on the temporary assistance report. Diane Anderson is not feeling well, so we will not be doing that. And now we can do the CPS. It is 6:18, so I'd like to try and move it along.
Why don't we defer it till next month or something?
I was gonna make a motion to table it to next
For
month.
next month.
Defer it.
Is that okay? Here, Lori's like,
We could, is there a
I-
committee meeting after this?
Yeah.
I don't think it's gonna be brief.
Well, they're here.
It's not gonna be brief. I mean, I'll tell you that right now.
Okay. Okay, we can,
I second that. I'm sorry, Lori.
appreciate you coming. Hopefully we'll try and do it next month.
Yeah, we have we have two more opportunities if we take
Okay.
them.
Is there any other than? Seeing none, do we have a motion to adjourn?
So moved.
Second. We're adjourned. All in favor of adjourning?
Aye.
Aye.
That's it.
We have a lot on our agenda.